All right, let me go across to Dr. Faheem Younus, who's the Chief of Infectious Diseases at the University of Maryland. He joins us now on the show. Dr. Younus, great to speak with you and have you on the India Development Debate and on ET Now once again. I must tell you, we've been getting a lot of queries ever since we put out the news that you're coming on the show, and I'm going to get you to answer some of them as well. But let me begin by getting your take on the second wave that has hit India. I want to ask you a simple question. Do you think, in your view, that the second wave of this magnitude is caused largely by new variants, new mutations, which are spreading faster and maybe more aggressive, escaping immunity more than earlier variants? Would that explain the whole surge in numbers?
Thank you very much for having me, Tamanna. I would not use the word escaping immunity because that's a big claim and we don't know that yet. But this is true that this new wave is most likely a combination of the virus's behavior and our behavior. These both things go hand in hand because the same highly transmissible virus is also in UK right now, or in many other countries, and everybody's not seeing the same wave. So what we do know is, number one, this virus is highly transmissible. The exact amount is unknown, whether it's 30%, 50% more transmissible or more than that, because genomic sequencing has been less than 1%. You need to do a lot more, 3 to 5% genomic sequencing in representative populations to draw those sort of conclusions. And at the same time, there is some of our own behavior when we declare victory too soon, when the world is open, when you're getting conflicting messages to people, and you have mass rallies and you have mass gatherings, then yes, even if it was the wild type virus, it will go wild. So it's a combination of all those things.
All right, tell me a bit about this variant, the B1.167. And of course, the contention over naming it after any geography is a separate story altogether. But let's look at the facts. Let's look at the variant. What do we know about it right now? And is it more dangerous, more transmissible, scarier in that sense than other variants which have been known across the world?
Sure. So I think what we do know that it's more transmissible and it's a variant of concern that we cannot dismiss it anymore. Whether it escapes vaccine immunity, we do not know. Whether it will reinfect people who have recovered from COVID, at least I do not think we know that. And whether it is more deadly or not, we don't know. However, just the fact that it's more transmissible, it's likely to kill more people. Simple math. If COVID kills 1% of all people and you have 100,000 people, if a virus comes and infects 100,000 people, you're likely going to end up with 1,000 deaths. If the same virus is 50% more transmissible, it may infect 1,500, 150,000 people now. The 1% of 150 is going to be 1,500, right? So without increasing lethality, this virus killed 500 more people only because it infected that many more. So I think those are the facts we know today. And that is why I keep telling people to increase their compliance with better quality masks and to avoid indoor crowds.
Tell me about why are we seeing infections even after both doses? Now, this is one of the questions that has emerged, Dr. Younus, because we're seeing this possibly around the world, but in India, we are seeing a fair amount of people with infections after both doses. There are deaths being reported of people who have taken 2 jabs and in some cases have even got COVID-19 once. It's placing and creating a lot of confusion in people's minds because you're wondering, if you've got both jabs, if you've got COVID-19 once, then ideally you shouldn't be in a situation where you're dying, or it should be very, very rare. That doesn't seem to be the case anecdotally.
Sure, but I don't see it that way. I think that's like saying why someone died in a car crash even though they were wearing a seatbelt. Nothing is 100%. Seatbelts are there to prevent deaths, but they will never prevent all deaths. And this goes in everything we do in our life. So I don't think the expectation should be that if you're vaccinated, now you can go into any crowd, into any situation, regardless of your immunity level, regardless of your host factors, and you will be fine. Nobody ever said that, and I think that's a mischaracterization. The reality is a vaccine is likely to make your infection weaker and ideally not make you infected at all. But if I'm an 80-year-old who's on immunosuppressive drugs, I get vaccine, I'm still at risk because my inner immunity is weak. So I think we should not focus on these exceptional cases. For example, right here in USA, we will still see some vaccinated people getting infected, but they're now becoming the exception, Tamanna. That's not the rule. Overall, the country has bent its curve and crushed this pandemic. We are having that many, we were having, let's say, 4,000 deaths in a day, and now we're not having 4,000 deaths in a week. So yes, we will have some exceptions, but I don't think that that's the right focus or the right framing. The framing is it prevented 90%, 95%. That's the sort of number. And I will tell people who are confused by that, do you have a better option? And if there is a better option, I'm happy to take that. But I don't think that anyone can bring any other option that's even closer to this. So I think vaccines are a game changer.
That's such a great example to want to emulate. You're talking about a situation where in the United States, where you're speaking to us from right now, where, that you had 4,000 deaths a day. We are in that situation right now in India. And you've come to a place where it's 4,000, not even 4,000 in a month. We're seeing pictures of people taking off their masks and life going back to usual. How can India achieve this? I know the short answer is vaccination, but the fact is that we are in the middle of a huge supply constraint of vaccinations. Does that push forward this return to post-pandemic life even further?
Sure. So I think some of this, I don't know what I'm about to say, how much of that is achievable versus desirable. But number one is aggressive mass communication. You cannot have powerful, influential people peddling pseudoscience now 14, 15 months later when 4,000 people are dying a day. To me, that's a crime. People cannot be doing that, and the government should lock down. They should really go after those people and challenge. Again, we need free speech and free society. But in free society, pseudoscience should be challenged very aggressively so people are not confused, number one. Number two, increase your testing. As bad as it is, you don't want to hide cases. You want complete picture, because that allows you today which zone is a red zone, which zone is a green zone, because you may have significant variation in spread in a large country. There may be areas where the spread is low versus very, very high, and then you focus on those, the red zones. Number three is increasing genomic sequencing, because that's like weather forecasting. That's going to help you plan for the next month. Increase your genomic sequencing to 3 to 5% if possible, so you can adequately then understand which variant is circulating. You may be surprised. We may be shutting down flights for a variant which is already endemic. What's the point of shutting down flights? So you will get further insight there. And I think that number 5 is really vaccination with a target-oriented approach. I think a country like India should be vaccinating 5 to 7 million people in a day. And then within 100 days, with social distancing. So now with all of this, when you do aggressive communication, you also limit indoor gatherings, you limit indoor big parties, big weddings, whether they are social, political, religious gatherings. If you do all of that, immediately you get on the front foot and you get on the office and control this virus. Use the next 3 months to mass vaccinate. And your goal should not be to come out of this wave to go into another wave 3 months later. Your goal should be to never let this sort of a wave ever come back. And that can only be achieved with mass vaccination.
So let me ask you about the third wave. Last week, I would say there was a lot of back and forth on the third wave. First, there was a statement that it is inevitable. Then there was a statement that we can avoid it. Do you think that a third wave can be avoided altogether, or at best, we can defang it, make it less impactful?
Again, I'm an optimist and I'm a believer that when people work together, magic happens. So I absolutely believe a third wave can be avoided, but it is going to require political will. It is going to require important people to work together like adults. And as long as we keep fighting over petty stuff, a virus or a public health emergency doesn't care about our religion and our politics and about our socioeconomics. And I keep bringing it up because we've seen that in America. Here in America, we politicize the virus and we paid a very heavy price. India should learn from us and not pay that same price. I think you are literally in a situation where your fate is in your hands, not in the hands of the virus. And people have to admit this. They have to deeply believe in this, that what happens 3 months from now or that third wave is in your control. Don't give that control to the virus.
Let me ask you about what you think we need to do right now. Today we had a quote from the head of the ICMR saying that any region or district in India which has a positivity rate of more than 10% needs to go into a 6 to 8 week lockdown. We've already been in some form of a protracted lockdown or versions of lockdowns in large parts of the country for about a month now. Is that the only way forward at the phase we are in, where we don't know if we've hit the peak yet, where we go into another round of stringent lockdowns?
So I'm a big fan of deference to expertise, and I like to talk confidently in an area of my expertise, and I try not to go into another areas, somebody else's area of expertise. Lockdown is a very complicated, interdependent, multidimensional sort of decision. This is not just about positivity rate. Lockdown, you need to take economics into account. You need to take your testing into account, your logistics and planning into account, because lockdown can only be a temporary measure for so many days. And you need to have a plan as to you're essentially gaining time. What exactly are you going to do in that time? So I can't say yes or no, because I don't have all those data points that your government and the decision makers have. And once you have all those right data points, then it's a very delicate risk versus benefit sort of strategy where it is right in some cases and not right in other cases. So I'm not trying to avoid your question. I'm just trying to practice my own principle of deference to expertise. I think the experts who are leading the effort must be looking at the right data points, and they should. All I can say is that their decisions shouldn't be biased by political, religious, or personal views. Just follow the science.
Okay, talking about the science, Dr. Younus, now there is a fear of new mutations developing the longer we continue in this phase of COVID-19, before we hit herd immunity, before we get enough vaccinations, and these could possibly then even escape the vaccines to come. Explain to us how that would work. Is this a valid concern that the longer we stay in this situation, we could have new mutations which could be even more aggressive?
Yes and no. I think, of course, we want to crush this pandemic quickly so life get back to normal and the virus does not get a chance to build more mutants. At the same time, this is not HIV, this is not influenza. This is a small mRNA virus and it's going to run out of its tricks. So I don't want to paint a doomsday scenario that somehow every year we'll continue to see a new mutation for the next 20 years and this pandemic will not end. That is not the right characterization. I think our goal should be the virus played on the offense in 2020 and we were on the defense. 2021, we need to play on the offense. The way to do that is with masks, containment of social gatherings, and mass vaccination, and remain focused. I mean, that's where our focus is. A lot of other things, what if scenarios, as important as they are, I don't think really they belong in media. I think they belong in the amphitheaters of academic medical centers. There's a lot of researchers discussing those things and working on those possibilities. You and I can only increase the anxiety of the people by discussing about those what if scenarios. I really would like to discuss what is and remain focused on that. And I can reassure you and your audience that this virus will end. It will run out of its tricks. The number of mutants it can throw at us we can throw back more vaccines at this virus, which will be more effective. And as we move towards more equitable distribution of the vaccine, it will end.
You know, I have a lot of people asking questions that they want to know from you, Dr. Younus, so allow me a couple of minutes to get answers to some of those. One question was whether a nasal vaccine, and there are some of those that are being worked on right now, would be safer in terms of clots, especially for people who are on blood thinners or have any kind of heart condition.
I don't know that. That data is not available yet. And nasal vaccines are in the phase 1 and 2 trial. I think they're months away. I would not at all wait for a nasal vaccine or any vaccine. I think whichever vaccine is available to you today is the best and the safest vaccine. You take that. As nasal vaccines become available, as we read their phase 3 trial results, we will know how effective they are and what is their side effect profile.
Another question that has come in, and a lot of people have, is what happens if you take too long before you get your second shot? And that's a very practical question right now in India. We're seeing policy change where vaccination for the category of 18 years to 44 years is being suspended in some places, and the government has asked for focus on completion of a second jab. The question is, what happens if you miss that window, which is right now supposed to be 6 to 8 weeks for Covishield and 28 days for Covaxin?
Right. So I think second dose has different protocols in different countries, depending upon the supply and demand equation. If you have too much vaccine, you can easily go every 3 and 4 weeks for the second dose. If you don't have too much vaccines, then this is a strategy to just stretch your vaccine, give a lot of people first dose, delay the second dose a little bit, so you start developing community immunity a little bit faster. I think there's nothing wrong with that strategy. People should know, however, that one dose by itself is not enough. So if you've gotten one dose, please make sure you consider yourself as if you're not vaccinated. You use all the right precautions. Wait for your second dose. 2 weeks after your second dose is when you will have full immunity. So just make sure that just know that you are getting that immunity in a stepwise fashion and you're moving in the right direction. But there's conceptually, scientifically, nothing fundamentally wrong between 4 weeks versus 8 weeks versus even 12 weeks for AstraZeneca.
Last question which has come. If you have had COVID-19, how long do you need to wait before being vaccinated?
It's a great question, very common question. CDC recommends 4 to 8 weeks. So essentially, you need to be fully healed and recovered from your COVID. I see patients every day, and they're with COVID in the hospital. And interestingly, I asked them, did you get the vaccine? And universally, the answer is no. So, which tells me that COVID, at least in America, where now vaccine is fully available, is not a disease anymore. COVID is now a choice that unfortunately some people are making, because I'm not seeing anyone with fully vaccination and then getting severe disease. But when I see my patients, this is my last conversation with them before they're going home. I tell them 2 things. 1, go be an ambassador and tell your friends and family that this is real and they should take it seriously because you just went through it. And 2, get your vaccine in the next 4 to 6 weeks because it will give you a longer and more stronger immunity. To answer the question, 4 to 6 weeks after you recover from your COVID infection.
Thank you so much, Dr. Younus. Thank you for speaking with us and also giving us a window into what will, I'm sure, soon be India's situation as well, where we've reduced COVID-19 deaths, where we can hope to get back to a life of normalcy. And of course, vaccination is the only way forward. Thank you once again for making the time to speak with us.
Thank you. My pleasure.
All right, we'll take a very short break here, but we have another very interesting interview lined up for you. On the other side, I'm speaking with Columbia professor and first vice chairman of the Niti Aayog, Arvind Panagriya, about his formulation of how India can get the vaccines they need. He also has very important take about India's current vaccine policy and believes vaccines should be free for all. Listen in after the break to find out why.